Fausto Biloslavo, so nice to see you after a while now, though the circumstances are not quite appropriate. But India's Prime Minister has just announced a complete all India lockdown for the next 21 days. And he means it, he says it's strict. We'll have to see how people respond to that. In terms of how Italy has dealt with that, some say that the lockdown in Italy came a bit late, but India is so much larger. We're talking about literally 1.3 billion people here, except for the emergency service providers. What lessons can India learn from you?
The decision of your prime minister is the right decision, in my opinion, because we had to do it in Italy before at the beginning. We didn't do it, and this was the mistake of our government because we started step by step. I can give you a very clear example. On 8 March, at the beginning of March, when the situation was already very bad, there was an announcement by Prime Minister that will be a kind of lockdown, but not complete lockdown, in some area of Lombardy, that is our main
in the north.
In the north main affected region at the moment. And what happened? The government decree was spread around on social network, and then the prime minister has to go on television during the night, and the result was that more than 10,000 people in only one night escaped from Milano, that is in the north, going to the south, go to the families to the south. Of course, personally, I never believed to do something like that. But you cannot believe that all the people are the same. The people are afraid. The people doesn't know what is going on, and what is going on is very clear. It is a war against an invisible enemy.
Again, when you're talking about a country of India's size, there'll be so many more problems. There's so many more poor people. There are migrants who are out of a job and they want to get home. There's no transport, etc. But it is, like you're saying, a war against an invisible enemy. As the Prime Minister pointed out, the facts in terms of numbers of infected. The first 100,000 took 67 days globally. The next 100,000, 11 days. And the third 100,000, it has taken it now to 300,000 just in 4 days. So the spread is enormous if these kind of precautions are not strictly implemented.
Exactly. And we were very surprised. I think nobody expected that in Italy, you can imagine, we are only 60 million people. So, I don't know, maybe one small town in India, something like that, some small town in India, or Kerala. I don't know Kerala how many. I was in Kerala, and I don't know many people in Kerala, but nothing, compared to India. And we were we are still surprised that we have more deaths than China, official number of China, because you never know, what really happened in China. But anyway, official number, and we are up to today, we have 60,000 people infected by the virus, but we believe that these are the people that are being tested, but we believe that the real number of the people infected is 10 times more. That means more than 500,000. You can imagine more than 500,000 for a country that has 60 millions. And you can imagine how shock was for everybody, even people like me that cover wars since more than 30 years, to understand last Saturday that we have the top of the deaths, that in my country, in some region, particularly in Lombardy, we lost one person every 2 minutes. Every 2 minutes. That means in one day, around 800 persons, that means one person every 2 minutes.
India again has, like you're pointing out, such enormous numbers and scales. Now, Italy is on a much different plane when it comes to development and in terms of the incomes that people have there. We also have to look at things of how do people get food if they're all staying at home, essential services like that. So it's important for the government, at least in India, to put those in place.
Yeah, take care about the panic of the people.
Yeah.
For example, I try also, we try with my newspaper, the magazine I write for, we try with television, everybody, we try to convince people at the beginning when the situation was not emergency like now, at the real beginning, that we have very few cases. You try to say to the people, don't panic, don't rush to the supermarket, to the food store. It's not need, but was an assault for the food that was absolutely not necessary, because we have no problem of food like maybe in India with so huge number of people you have, could have. And but in any case, nobody understand. That means the majority understand, but a big minority of people just assault the supermarket. Even now that again we are in a kind of lockdown, not completely, unfortunately, because I have to say the only thing that I would like to copy from China is the China system in this emergency. Close everything, army in the street, and this is finished. No discussion, and then we'll see after 3 months. And of course, in a democracy like India, like Italy, maybe is difficult, but is necessary, and is necessary to avoid panic. Panic of the people is panic without reason, because even now people goes to on long queue to take food. And so when everybody say, of course the number are different between you and us, but everybody say use the online. And look, for example, in a small town like Trieste where I am, we can still use to order the food online, and then to deliver the food more safely, more quietly, with no possibility to be affected. But in Milano, for example, that is a big town with millions of people, all the delivery system of the food online is out. Is out because you can take the food after 10 days, 20 days. There is no, there's been no organization. I think that you defeat this invisible enemy and you win the battle if you move in advance. You move before, like your prime minister say, lockdown from the beginning.
Yeah, you have to be ahead of the curve. Now, you're saying there should not be panic, but we know what human emotions are like. It's panic without reason. But we've seen it's also necessary to warn people to be aware of how dangerous this is. And we've seen horror stories from Italy that we do not want repeated anywhere else in the world, of course, with doctors having to decide who will live and who will die because they don't have the intensive care equipment, they don't have enough protective gear. That's another reason possibly why the numbers are so large in Italy, because your health workers are getting infected, and that's also directly impacting on serving the patients.
This is a big danger. This is a big danger. I can say that I talk with readers, our readers, that were living in the epicenter of the infection of the virus, in some very small town, just 10,000 people. And our reader, for example, he lost his mother. He lost first his father, then his mother, and he was also infected. You can imagine every house in this small town, lost somebody. Doesn't exist any health structure that can support this kind of disease if the disease will be all over the country. Now we are, and we are proud of our health care people that are really sacrifice themselves, because of course it's you cannot avoid, that the people are on the first line in the hospital, in the COVID area of the hospital, in the intensive care, and so of course they are infected sooner or later, and the problem is that likely we can say, we are lucky, that the epicenter starts in Lombardy, in the north, where we have a quite strong health structure. We are very afraid if now the virus will go down in the south, where we don't have the same structure, it could be a real nightmare, a near disaster. This is one of the things that also in India you have to think about it, because maybe some area or some town are more organized than other. Look what is happening in Spain, just a few weeks after us, they are collapsing. They are collapsing. We are fighting, we are struggling not to collapse. Now this is the major fight of the people involved, not to collapse the health sector, not to collapse. This is the reason why, for example, also with our newspaper, we are collecting money to build hospital, to build hospital everywhere, to make intensive care everywhere, to make as many as possible beds for the patient, for the people infected, and this is the main battle at the moment.
Like you're pointing out, Italy itself has, you're worried about the healthcare system in the south. In India, there's such a wide disparity in healthcare among the states, as you're pointing out there as well.
Yeah.
But is one of the reasons why Italy is the epicenter in terms of the number of people affected, infected, and the number of people who have died, also because you are the second oldest country in the world after Japan? So there are people who already have illnesses.
Yeah, that means this story that only the oldest people, are affected, is partially true. Is partially true. That means are affected also young people, people of 30 years old,
Yeah.
But the difference is that the people over 70, over 80, are more affected because they I don't know, nobody know exactly why, because maybe they have no enough power in the body, to struggle against the disease. They die more than the youngest people, but all the people are in danger, of every age. The problem for the oldest age, is that they die more. Sorry that I forget to tell you one more thing. There is a discussion in Italy. Also, I make a point in my newspaper about this, that we have to show also the most dramatic scene, the most dramatic picture of people dying in intensive care. We have to show how difficult it is to fight this battle for the healthcare volunteering, the doctor, the nurses, and so to show everything. Why? Because when we didn't show at the beginning too much, but just a little bit, the people say, "But what is that? Nothing special." And on weekend, on Saturday night, everybody were around drinking, laughing, and talking, and so. Now, I was one of the first to publish the story and the picture of maybe you see it, a long queue of army trucks that were,
Taking
yeah,
coffins.
tracing the coffin from one town, Bergamo, that is being heavily affected, to the crematory to cremate the death, the victims. This was very very important, very important. You can imagine that after that was a reduce of 20% of the people all around in the street.
I've seen other pictures also of coffins with bodies, rows of them lying in a crematorium. But the story tells about the family who can't say their last goodbyes because they themselves are in quarantine. So they are, like you're saying, very important to put out those pictures. It's not sensationalizing anything, but it's to get the message across. But just on a better note, if I can say so, Italy is also known for a very close social contact matrix. Even in India, we are very close as families, as friends. And we've seen the other pictures that have also evolved of people in their balconies, whether it's in Milan, whether it's Bergamo, singing and joining in music to keep the spirits alive, even though they are separate from each other.
Yes, yes. This is another important point. If we know, if we'll think also after this tragedy about the lesson learned, the lesson that I learned, but I learned many lessons, in these days. The lesson that I learned is that when situation getting worse, when you face the deaths, when you are in a war, also if it's an invisible war against an invisible enemy, our community, I think all the communities, but in the world, but our community much better than before when we fight each other and everybody talk everything against another, and so politicians. So our community strength, strength. Reinforce themselves, and is the time that I saw our flags on the balcons. I know that India maybe are more patriotic than us, but this disaster, thanks to this disease, terrible disease, we discover again the sense of a community, the sense of our homeland, the sense of our flag. And yes, it's true. We sing in the balcony, all kind of famous Italian singers. So, but every time we start with our national items, and this is a lesson for everybody. Don't forget that we are united, even if we are weak, if we are heavily damaged in this moment by the disease. We are united. We are Italy.
Fausto Biloslavo, thank you so much for giving us a sense of what is happening from Trieste, but for the whole of Italy, and the lessons that other countries, including India, should learn. Hopefully, the next time we talk, things will be better, though it's going to take a long time.
Thank you very much, and good luck, brothers.